I'm Dr. Halie Fetters. I'm one of the ER doctors here at Revive. I think the biggest thing is Revive has done a really good job at building a really strong ER team. So we take care of the ICU patient, but we also take whatever emergency patients walk through the door, whether that's because they ultimately need surgery or whether they're having a true life-threatening emergency. And with that, we get to have all the same tools that the specialists do. The CT, the OR suites, all of our ER doctors cut. I think that's very unique compared to a lot of specialty hospitals where ER, you see the cases and the next day they go to the specialist, versus here we're able to continue to take care of the pets and collaborate on their care the whole time they're here with us. The best thing is we have everything in one place. Like we have almost 24/7 access to specialists, whether that's neurology, internal medicine. We have a CT that the ER doctors and the specialists both have access to. We can do surgery anytime, day or night. So it's just nice to be able to have all of that in one building and get answers for things pretty quickly. It's really nice having specialists literally down the hallway. And so even if you come through ER, if we think this is going to be a surgical case, we're going to walk down the hall and talk to our specialist and see what other advice and input they have, how they would like this case handled, and how quickly can we get you seen and get them to collaborate on your pet's care. And so I think that's the best part. The biggest thing is this is what we're here for. And so like an emergency is really stressful, but this is all we see and all we do 24/7. And so we know it's stressful, we know it's an emotional time, but we're here to help you and help your pet and make sure we have the best plan moving forward. Whenever they go home, we go through a whole list just because we know there's a lot of questions like what's normal, what's not normal, what are we looking for as far as the incisions going, medications, when are they next due. And typically we recheck them in 10 to 14 days. We're here 24/7 if they do have any questions, but most of the time you're looking at a 10 to 14 day healing process. We recheck, and then typically it's all clear from there. I started volunteering at the first practice that I worked at when I was 12 years old, and it was mixed animals, so got to see everything from emergencies, horses, goats, dogs, cats, even saw a few exotics when we were there, and that I really enjoyed that experience. And it was rural, and so we were the only ER within an hour. We were technically just a GP, but you had the doctor's cell phone, like it was that type of veterinary practice. And I just grew to love that. I worked for that place for 10 years between volunteering and actually working. And I can't think of anything that I'd like to do more. The biggest thing for me is finding what's important, like what matters to you about getting your pet home and making a plan that's realistic for them and addresses their concerns. Some cats especially, we're not always able to medicate them. If I send you home with meds but you can't use them, that kind of defeats the purpose. And so really getting to know what's important to the pets and to their families and collaborating on their care and making something that's realistic but meets the concerns of the family, but also what we find that's potentially concerning for the health of the pet. The case most recently that comes to mind is we had a cat here. His name is Atlas, and he came in for anemia. That was pretty life-threatening. He was actually a relatively rare blood type, especially for a cat, type B. And so he was in hospital for a few days. He got multiple blood transfusions. We ran out of type B cat blood that we had here. We were able to get some from another local hospital, but then all of DFW, no hospitals had any more type B blood. So we actually drove as far as Louisiana and Oklahoma to get more blood from him. And ultimately he made it out of the hospital. We rechecked him a couple weeks ago. He's doing fantastic at home. And so it's cases like that make me realize why I'm doing this. That's important to me. And I think that's something that's important to parents too. And one of the reasons I really enjoy this hospital as a whole.